Hey guys, this is Brittany Hargrove, and I am presenting my final project, my investor pitch deck. We're going to start with key concepts in the course overview, talk a little bit about what the course topics were, what I learned, and how I plan on applying it. So the course was centered around social entrepreneurship. We discussed the differences between a conventional entrepreneur and a social entrepreneur. We'll look at a couple of those here. One thing under conventional entrepreneur is the individualist vision. What that means is that the conventional entrepreneur has the goal of creating a market or addressing a market, selling a good or a product, and bringing in a revenue. The social entrepreneur is more concerned with a community vision. They're identifying a problem in the community and trying to address it through a solution. The conventional entrepreneur looks at goods and services for the market, while the social entrepreneur looks at goods and services for the community. So the conventional entrepreneur is focused on the market and traditional performance measures, where the social entrepreneur is focusing on the solution of a social issue. They measure their performance based on social change that they affect. A really great example of a social entrepreneur is Blake McCoskey. Blake is the founder of Tom's. Tom's popularity has spread like wildfire, which is a good thing for both McCoskey and for the people that Tom's aims to help. McCoskey founded Tom's in 2006 after a visit to Argentina, where he learned that many children get sick or injured because they do not have shoes to wear. To combat this, he created Tom's, a business that donates one pair of shoes to needy people for every pair that's bought. So far, the company has donated more than 1 million pairs of shoes. In 2011, the company launched another initiative which aims to give away a pair of glasses or sight-saving surgery for every pair of sunglasses or glasses sold. So what Blake did was identify a social problem, identify a problem for a target community, and then develop a solution to that problem. For him, the problem was that children in this country were suffering from injuries and infections because they didn't have shoes. So his solution to that problem was to develop a company that sold shoes, so it's making a profit, but it's also solving a community problem, a social entrepreneurship. We discussed the differences between a business plan and a business model. A business plan is probably what you would hear about or see for a company that is already well established. They're looking at execution. What can we do? We're thinking through execution, finances, marketing, executive summaries. Whereas the business model is a better thing to start with if you're a startup. A business model breaks down what it takes to create, deliver, and capture value. There are several segments in the business model canvas, which is what we discussed and worked through in this course. We're going to take a look at those different building blocks over the next couple slides. This is the business model canvas. The business model canvas breaks down into 9 building blocks, everything that you will need to start a business. It's important to remember that your business model canvas and the segments will change and be adjusted throughout the process. As you create your value proposition and identify your customers and channels, you may notice that you need to tweak these segments in order to fit the actual market or when you're testing your assumptions. A value proposition is the package or value you're offering. For social entrepreneurs, it is important to identify the problem you want to address. Your value proposition is the solution you are proposing for that problem. Customer segment. Once you've identified what value you are offering, you need to identify who you are offering it to. It is important to really illustrate your average target customer. What are their problems? What do they need or want in this area? What kind of lives are they living? This will tie in very closely with your specific value proposition. Customer relationships. This segment explores how you will find, keep, and grow customers. How do you market to these individuals? Once you've acquired customers, how do you keep them happy and interested in your value proposition? So one example that we learned in the reading was that of a grocery store. So the value proposition, what they're providing is foods and goods for a target audience. Their customer segment would probably be their local community. Customer relationships, they may be posting flyers, they may have commercials, they may run specials on different items. We'll take a look at that example from our reading in the next couple slides. Key activities. Key activities are the activities needed to support your value proposition, reach your customers, and maintain good relationships to support your overall business model and business plan. Key resources. This segment is similar to key activities in that it focuses on what will be required to achieve your overall goals, but this segment focuses specifically on the items or resources needed to achieve each segment within the canvas. What products are necessary to craft your value proposition? What is involved in your marketing strategy, and what will you need to make that happen? Key partners. This segment is tied in very closely with all other segments. It is possible that partners will be required to support your business model. Going back to the grocery store analogy, you may need partners that supply certain food items. You may have a partnership with a company that manufactures vending machines, software, or cash registers. These partnerships are vital to the success of your business. Cost structure. This piece identifies what costs are inherent to run your business. It is important to identify where your largest costs are and brainstorm some cost-effective solutions to your greatest needs. Revenue stream. Once you've identified what your value proposition is, who your customers are, and how you can acquire them, it is time to look at what you believe your ideal customer is willing to pay for the value you are offering. To do this, you will first need to have your research done on your target customer. You will need to know if they already have this service, and if so, what they are currently paying. You need to try and identify why your version of the value is the best one for them and build this into the cost of your value proposition. So with the grocery store example, your revenue stream is obviously going to be people coming into your store and buying your goods. When we look at channels, this segment focuses on how you will get your value into the sight and hands of your customers. This could be a blended approach or a very specific approach according to your market. With newer technology, there are more options to place your value proposition in the eyes and minds of your customers. So if I'm a new grocery store, a small store in a town, I'm going to look at posting some flyers like we discussed earlier. I may try to outline for the customer that I sell only organic produce, and that would be kind of my niche market. You want to take a look at those things as you're creating your business model canvas, and again, you're going to need to adjust your segments as you develop. So through this course, I've learned a lot. I've learned the 9 building blocks of a business model canvas. I've learned the nature of a social entrepreneur and the unique challenges that one faces in the business world. I now have a deeper understanding of what distinguishes a business plan from a business model. I've learned that revenue streams can be creative and often change over time. I've learned that the channels I use to reach my customer can be just as important as the customer relationships. And I now feel more confident in moving forward with my studies and the development of my business idea. We're going to move into my investor pitch now. So my company is Mobile Counseling in the City, bringing recovery to your door. Did you know that Florida spends nearly 20% of the state budget on substance use? Only 2 cents for every dollar spent in the state is spent on preventative measures, yet 98 cents on every dollar is spent on the consequences of addiction. This disconnect is largely caused by a lack of accessible care. One of the largest barriers to treatment is transportation and confidentiality. The mobile counseling model provides a solution to individuals facing these barriers. Mobile Counseling in the City brings the counseling services to the client, allowing the client access to care, confidentiality, and the ability to maintain their daily lives with minimal interruption. I'm Brittany Hargrove, and I started this company out of a desire to change our city. With your help, I can continue to provide treatment and support to our city, helping people return to self-sufficiency and improving our community. So Mobile Counseling for the City, bringing recovery to your door. Our mission, Mobile Counseling in the City, seeks to provide healing and hope for the individual facing addiction. We do this by providing solutions to common treatment barriers and empowering people to maintain their current support systems. Our vision, Mobile Counseling in the City strives to provide the best counseling services while maintaining easy-to-access care. We will seek out those who cannot find recovery through traditional means. We will empower these individuals to return to self-sufficiency and their community. So what is the problem? How pervasive is the problem? 15.9% of Americans, or 40.3 million, have the disease of addiction. This is more than have heart conditions, which is 27 million, and diabetes, 25.8 million. 13.7%, while not addicted, engage in use of addictive substances in ways that threaten health and safety. This is a big problem, and it's a growing problem in America. So what's keeping these individuals sick? Barriers to treatment are common obstacles that prevent an individual from receiving the services they need to obtain remission from addiction. When an individual faces barriers, they oftentimes do not access treatment, and their addictions grow and worsen in symptoms and consequences. You'll hear me use that term a lot through the slide, barriers to treatment. This is basically obstacles preventing somebody from receiving the services they need to recover and heal from a substance abuse problem. Some common barriers to entering treatment: travel costs. Maybe they don't have a way to get to the building that's providing the services. Maybe they can't afford a monthly bus pass, or they can't afford gas. Transportation access. Maybe they're in a remote area. Maybe there is no public transportation. Time away from work. Oftentimes when groups are going on or services are provided, most people work, and they're not able to break away from that work because they can't afford to lose the hours. Childcare. Stay-at-home parents are often the primary caregiver and unable to leave a child or pay for childcare in order to take themselves to an area where there are services provided. And lack of service providers. There are many areas across the nation where service simply is not available. Several people are faced with the obstacle of traveling to the closest urban area for services, and they're oftentimes not able to do this. Is the market there? So the latest research shows that substance use is increasing. Overdose deaths in Lee County, which is where I'm located and where I plan on launching this initiative, increased from 171 in 2013 to 955 in 2017. That's over 800 more people in that time span dying from overdose deaths. In 2016, Florida had a state budget of $78.3 billion. With the current 20% spending trend, Florida is spending $15,660 million on substance use in the way of prevention, intervention, and treatment. Nearly all of this is spent on the consequences of addiction, in the way of taxpayer support for jails, emergency personnel, and damage caused by substance-related accidents. All of this money is being spent primarily on the consequences of addiction. There's not nearly enough effort or finances poured into the prevention or intervention. We have the ability and the opportunity to intervene in somebody's life before they get to the point where they're reaping consequences that now affect the state budget. Across Lee and Collier counties, there are 13 substance use treatment facilities that offer counseling services. Again, Lee and Collier County is the Southwest Florida area, and that is primarily where I will be launching my initiative. So this is 13 organizations to serve the nearly 1 million people living in these two counties. In the Southwest Florida area, there are no mobile addiction counseling services. However, there are several addiction counseling treatment facilities all across the state. This is why we must present a unique approach to the problem. So there are ways to find treatment. There are several people offering this service, but there's nobody offering this service in home. So most people are struggling with addiction, and they're seeking treatment through hospitals or residential treatment facilities or local counseling centers. The problem with these traditional models is that they do not provide any flexibility in the treatment process. With traditional models, the client has no choice but to receive services at the company building at predetermined times and dates. The client does not have an option to change group session times or maintain privacy by staying out of the treatment center building. So for that working professional we talked about, if the substance abuse group or the relapse prevention group that they're required to go to, either through the state, through court, or maybe they're doing it voluntarily, if that's offered at 6:30 p.m. on Wednesday night and that's it, and that's the only thing available in their area, and they work an evening shift, they're unable to make that group. So who is the customer? I think it's important to highlight that there is no standard profile of an addict or alcoholic. There are many factors leading to addiction. This is important to remember when we think about the target customer. We need to remove our own biases and focus primarily on the barriers that prevent people from receiving treatment. So as we're looking at our target customer, yes, it's going to be somebody suffering from substance abuse, but again, we need to remove that bias and think of them as the whole person, as a member of the community. So what barriers are they facing? Maybe they don't have access to treatment. They're in a remote area. Do they have transportation to treatment? Maybe they don't have a car, or they don't have a license. They don't have a friend that can drive them. Do they have any childcare? Are they unable to leave the home or leave their children at home to seek services? They fear their identity being known. Several people fear the stigma associated with addiction, and they don't want to be labeled. They're court mandated to complete counseling. So oftentimes when somebody struggles with substance abuse, they end up with legal consequences, and the courts mandate that they attend treatment services. Maybe they're barred from other local resources. Several times, if somebody is in active addiction, they may receive services from their local counseling center, but because they continue their substance use, the counseling center is no longer willing to see that client. Maybe they can't fit counseling into their schedule. We talked a little bit about that. Maybe their work schedule prevents them from receiving services that are offered in their community. So meet Mary. Mary is a 35-year-old mother who struggles with addiction to alcohol. She's been in and out of hospitals and treatment facilities. She's now been charged with child endangerment and faces losing her daughter to the state. Mary is desperate to find help, but she's no longer eligible for services at the local counseling center since she has attended 3 times in the past 2 years. Mary is trying to fulfill the requirements of Child Protective Services while also treating her addiction. She cannot find childcare, and she's fearful to leave her daughter's side. Mary benefits from having a substance abuse counselor come to her home and provide services. She is able to stay with her daughter, meet court requirements, and recover from addiction. This is a classic example of one of our target customers and the type of person that I work with every day. There are several parents who are now caught up in the legal system trying to meet requirements from Child Protective Services, at the same time trying to maintain a home and work or school, and also trying to find addiction services. It's very difficult to balance these things, and it would be made much easier if the counselor could come to the home with the parent and provide these services. This is one example of our target customer. Another example is Steve. Steve's an accountant and has become recently addicted to pain pills after he had a surgery. Steve has never dealt with physical addiction, and he feels ashamed that he needs the pills to get through the day. After doing some research, Steve decided not to pursue substance abuse counseling because he was worried his coworkers would find out. He does not want to attend groups and meetings, fearful that people will label him. Steve is growing more worried and starting to notice that his work performance is suffering due to his addiction. He knows that he needs help, but fear keeps him from seeking treatment. Steve would benefit from having a substance abuse counselor meet with him in his private office or home. He is able to learn about substance abuse and get the counseling he needs while maintaining the privacy he values. This is going to be another great example of our target customer. There are several working professionals, especially in the Collier County area, that are concerned about being labeled and associated with addiction. They know they're facing addiction. They probably don't have a lot of information on what addiction looks like or what it can become. They know they need services, but they're scared and ashamed to address those. So let's look at the traditional versus the mobile counseling model. So for this, I just kind of took the main source of services in Lee County, which is Salis Care, and then another really popular counseling service in Collier County, which is Counseling of Southwest Florida, and I've kind of matched them against the mobile counseling model. So location, is there any flexibility in location? You'll notice for Salis Care and Counseling of Southwest Florida that there is no flexibility. They've got the brick and mortar building, and that's where all of their services are provided. Whereas the mobile counseling would have flexibility in location. We could meet in home, we could meet during lunch breaks, we could meet in the park or library or some other predetermined safe location. Is there flexibility in the group or individual sessions? So again, with Salis Care and Counseling of Southwest Florida, there's not a lot of flexibility. There's a little flexibility. Maybe both facilities offer 2 substance abuse classes, and one's on Wednesday and one's on Saturday. So there's a little flexibility as far as variety and options, but there isn't flexibility for you as the client to select the time you'd like to meet. With the mobile counseling model, there's flexibility for both of these. I would have the freedom to come to the home after hours, after normal work hours. I'd be able to move around group sessions based on the group consensus of what they think would be a good day and time. I would have complete flexibility over scheduling. And the last thing we're going to look at is pricing. Is there any flexibility in pricing? So for Salis Care in Lee County, they only accept insurance. They do not accept self-pay. Counseling of Southwest Florida has set pricing, and they're not willing to budge on this pricing. With the Mobile Counseling Center, I again would have the ability to be flexible in my pricing model, and are currently looking at the possibility of a sliding scale. So is this needed? Do we think that the community would embrace the mobile counseling model? Well, I've talked to a couple of local professionals who actually seem very excited for this. Here's the feedback of two professionals I've spoken with. The first one comes from Kayla Pollitt. She's a Master of Social Work, and she works in one of the Lee County School District high schools. And in a conversation with her when I was discussing if the need was there in the schools and what solution they were currently using, here's her feedback. She says, when I meet with parents, I don't know what to tell them. We have a large, impoverished population at our schools, and most of them are financially burdened and do not have reliable transportation. Because of life struggles, they often abuse alcohol and other drugs. If there were a way to get the counseling service to the parent, I have a feeling we would see an increase in the success of our students, benefiting from a healthier home. So not only is she saying that the problem is there, but she also is kind of at a standstill and is not sure where to refer these parents. And she's dealing with the back end, the children who are really reaping the consequences of their parents' substance abuse. So by providing this mobile counseling model, we'd be able to help the parent, and at the same time, we would see the positive impact it has on the children and in our school district, eventually having the positive impact in the community as a whole. So the next professional I spoke to is Sarah Larimore, and she is a licensed mental health counselor. She says, I can't believe more people are not offering in-home counseling. I've seen it done through DCF, or the Department of Children and Families, but that is reactive counseling. This could be a preventative measure. This model would be ideal for the addict who has not yet hit rock bottom and still wants to maintain their privacy. I would support this counseling model and would feel comfortable referring my clients to this style of counseling. So Sarah's currently working with people who face substance abuse, and as she mentioned in this quote, she's seen the mobile counseling model implemented through different children's and family services. So oftentimes social workers will come into the home, they'll do home visits, they'll talk with the parents, they'll see if the home is a safe location. But again, this is reactive, like she mentions. This is on the back end of something that's already happened. The mobile counseling model could also be used as a preventative measure. We'd be able to get into the home of somebody who maybe wouldn't seek treatment on their own and intervene with their substance abuse progression, hopefully before they hit too many consequences. So mobile counseling in the city is unique. Why are we unique? Well, we provide flexibility in our service model. We have after-hours counseling. We're able to meet with a client in-home or other safe space, providing privacy for the client. We're affordable and accessible. We have free court appearances, which are oftentimes necessary for somebody who is court mandated to receive counseling. They have to appear before the judge a few times throughout that time frame that they're given, and it usually helps their case if their counselor is able to appear with them. This is a service I'd be willing to provide. We're not government funded, and that gives us flexibility to customize our treatment plans. So how are we going to get our customers? How are we going to get out there in the community? Well, our initial customers are going to be through word of mouth referrals and direct marketing response. We'll be listed on court referral sheets, and our presence in the school system will allow us to gain a foothold in the Fort Myers recovery community, allowing for more word of mouth referrals. So we're going to get the word out through direct marketing pieces, and there will be an initial response to that, and we'll gain some customers through that. Oftentimes in this sort of a community, the recovery community, once one addict hears that somebody's received positive treatment and positive services from a company, that addict is also going to try to reach out to that company. So that's our plan for Lee County. In Collier County, we're going to take slightly a different approach because there are more services being offered in Collier County. So we're not going to try to directly oppose the current treatment facilities, but rather we're going to try to target the client who's no longer eligible for the services. So I mentioned a little bit earlier that sometimes somebody facing substance abuse will be ineligible for services at a location because they've already received services too many times in a short amount of time. So with substance abuse, it's very progressive, and oftentimes if somebody goes into remission for a month or two, they may relapse, begin using the substance again, and once again have to start all over with their services. So when that happens so many times, service providers are kind of forced to cut off the service to that client until they feel that they're at a point where they can actually change. So we're going to identify these people in Collier County, people who are no longer eligible for current solutions, and provide them services through our company. So once we've established our presence in the community, we're going to move our strategy to a little more aggressive approach. We're going to highlight our unique and flexible services through marketing, and this will gain us new customers. So once we've already kind of created that positive rapport with the community and the recovery community and other service providers, we're going to kind of build off of that and really highlight why we are unique and highlight success stories that we've gained, and this will naturally bring in more customers. So our marketing approach is going to focus on creating powerful print and videos that detail stories of those that are hurt by addiction. We will then capture the restoration that comes with recovery, and this will create funding interest as well as motivation for current addicts to seek help. So what I've noticed working through the nonprofit that I'm currently with is that when you can capture a success story and get that success story to the community in a piece that is moving and beautifully done, that then ignites interest in the community and it naturally brings in funding. And this is the approach we're going to take. Partnerships. So I highlighted this a little bit. We'll just kind of overview this. I'm going to be partnering with the Lee County School District, which currently has no referral system in place for parents struggling with addiction. We're going to be partnering with the Lee County Courts and the Collier County Courts, and that is going to be our name is on the referral sheet. So when an individual is faced with legal consequences and they have to appear in front of the court and the judge says that they are court ordered or required to complete substance abuse counseling, here is a list of providers, and that individual can take their pick. We will be on that list of providers. And word of mouth referral, of course, and again, that is created through having a presence and starting to gain a few customers, and then the word gets out. This is just a breakdown of what I believe, what percentage of our customers are going to come from each of the partnerships that I just highlighted. Service pricing model. Okay, so we are going off of a service pricing model. That basically means that I'd be charging based on service. So these are the primary services that I would offer. We've got the initial assessment, which is required for all new clients and is the first thing done. It takes about 45 to 60 minutes. So it would mean meeting at somebody's house for about an hour. They would complete some initial paperwork. I would input this into my computer system. And then from that initial assessment, I would prescribe them individual and group sessions. So the individual sessions are about 30 minutes, group sessions are about 60 minutes. And again, we're charging per customer, per service. Drug screens are an inherent part of this process, and typically somebody would receive 3 drug screens during the service period. That takes about 10-15 minutes unless they tell me they can't go, and then we're sitting in a room and waiting for them to be able to provide a sample, which actually happens pretty often. Court appearances, and again, this time is going to vary, but this is a free service that I would not be charging for. There would be some cost to me for gas and my time, but I know that it's very vital in the process, and I am fully willing to absorb this cost. So a typical customer is going to require 3 months of service. What that looks like is that initial assessment, 3 individual sessions, and 12 group sessions over about 12 weeks. And somewhere in those 12 weeks, we would have 3 drug screens. So again, the initial assessment is $75. The individual counseling sessions are $150 for 3. And then 12 group sessions are going to be $360 plus 3 drug screens, $75. That equals $660 per customer that I'm bringing in for approximately 3 months of service. Now, this is before I take out some of the cost. So let's look at expenses a little bit. This, just for simplicity's sake, I based this on 100 clients. My marketing and materials per year, you'll notice I included gas, drug screens, my computer documentation system. That's basically just a fee for membership for the software. The rental space, and I'm hoping to not really need the rental space in the beginning, but again, just for simplicity's sake, I estimated about $300 per month. I would probably work with another partner and just kind of rent a conference room at a local nonprofit. I've currently been talking to a couple and they do seem to be open to this. And then we have my salary, of course. At this time, I would be the only paid employee. And then continued education credits. These are necessary for anybody who has licensure through the state. So financial projections, again, you can see that the total revenue is going to increase. Total expense stays about the same. So this is again assuming that I am the only professional providing the services. If I were to add another professional, that total expense would go up. But you'll notice that I definitely have revenue left over to reinvest. So just kind of an overview of the business model canvas. This is the template that I outlined in the beginning of my presentation. And this is the different segments where I've sort of plugged in what I have developed for mobile counseling in the city. So again, you'll notice that what I'm offering is a mobile counseling service. I'm offering it to busy professionals, stay-at-home parents, non-driving clients, the different target customers we outlined earlier. My customer relationships, I'm going to reach these customers through news articles and social media posts, court referral sheets, and I'm going to keep them by offering individualized treatment, personal accountability, and support for them and their family. One thing that I've noticed is really vital in this process for substance abuse recovery is that the individual who's receiving the services knows that they are an individual, knows that you view them as unique and special, because oftentimes people in this situation are not only marginalized but generalized. They're labeled and there's a lot of stigma associated with substance abuse. So by treating them like an individual with respect and dignity, that will naturally keep them engaged in my company. So how am I going to grow my customer relationships? Well, my partner referral program, for example, I'm thinking about partnering with other professionals, maybe other locations who offer substance abuse counseling and who are no longer able to see an individual for the reasons we talked about earlier. So if they were to refer that individual to me, not only would that individual receive somewhat of a discount, but I would also reciprocate and maybe pay them a small referral fee or also refer back to their organization if I'm unable to help somebody. So my revenue streams, again, they're paying per service, partnership referrals, and hopefully grants. My key partners we outlined in the slide earlier. We've got the Lee and Collier County courts and school districts and other recovery facilities. I'm also going to have to partner with the Florida Certification Board to keep my certification in order to provide this counseling. My key activities, there's a lot: driving, counseling, administering drug screens, going to court, facilitation of group sessions, attending local board meetings. So there's a lot kind of wrapped up into this. But again, my cost is actually pretty low. The cost for my key activities and resources is pretty low. Key resources, my certification, licensure, drug screens, a rental space, my vehicle and gas, my phone line, marketing, branding, and grants. Okay. So meet the team. So I am Brittany Hargrove. I am a dedicated addictions professional with 5 years experience treating drug and alcohol addictions. With a degree in addiction studies and a personal testimony that lends to my expertise, I've developed a method for delivering services that allows individuals to treat their addictions while maintaining the positive support networks they've already worked on. And then Jonathan Hargrove. Jonathan is a marketing and design professional, and he's worked with major nonprofits, increasing awareness and raising revenue through digital, print, and online marketing. His ability to capture personal stories and experiences allows us to have an influential presence in the marketplace. His expertise in branding creates a consistent and professional identity for the company. He actually developed the logo that you'll see back on slide 1. Investment. So we're going to be raising capital through grant funding and personal donations. We'll most likely start with personal donations and pull from savings of my own to kind of launch the company. And we're going to use these proceeds for founder salaries, sales and marketing, savings, and then our capital expenses. So where are we now? Mobile counseling in the city is still a developmental stage. I'm working on licensure process and creating relationships with other professionals. I already have the digital and marketing professional ready to begin branding. As you saw earlier, we've started a little bit of work on the logo. So I'm currently saving for the capital costs and hoping to finish my master's in business, my MBA with a concentration on social entrepreneurship. But really the company could be fully functional by January 2019, as the completion of my master's is not essential to launching the company. Mobile counseling model is the counseling delivery method of the future. Several allied health fields have realized that delivery of services is the best way to ensure that individuals heal and recovery. Technology increases our ability to deliver services to isolated areas. With new technology, I will also be able to reach customers through channels like Skype, FaceTime, and other video-based communication systems. This method allows us to provide recovery to so many individuals who would not otherwise have access to care. When individuals recover from addictions, they become even more invested in their families and communities. I truly believe that this business will have a direct impact on the healing in our cities. So that's my presentation. I really believe in this initiative. I really believe that I've identified an important social problem and created an important solution to that problem. So I hope you enjoyed, and I am open to all feedback. Thank you.